Okay, I'm going to call to order. Roll call, please.
Dr. Moore,
Present.
Ms. McGregor,
Present.
Dr. DeGuzman, Ms. DeWitt,
Here.
Mr. Adamson,
Present.
Mr. Griffith,
Here.
Ms. Johnson.
Okay, so I do believe we have enough for quorum. And we have a new member, Ms. McGregor. Could you tell us a little bit about yourself, please?
Oh, gosh. Hi, everybody. Thank you for having me. I am a critical care OB nurse by clinical training. And after I went back and got my master's degree, I went over to the dark side of administration. But it was not in the nursing line. So my specialty is business development for health systems. And I've done everything from recruit physicians to employ them to women's health startup and raising Series A funds. So I've kind of been all over the nonprofit and for-profit side of the world, and I retired at the top of 2022. So I'm glad to be here.
Welcome.
Thank you.
Okay, we have any additions to the agenda? Are there any additions or modifications? Okay, can I have a motion to adopt the agenda?
Second.
Okay, and if no discussion, all in favor?
Aye.
Aye.
Opposed, inside? Okay, now the motion has been carried. Carried. Okay. Approval of the last last meeting. Are there any addition or modifications that we have since you've read the minutes? No. Okay, so I have a motion second to adopt the minutes.
So moved.
Second.
Okay, any discussion?
No. Thank goodness.
Okay, could I have a vote, please? All in favor, say aye. All opposed, same sign. Okay, motion carries. All right, public comments.
Did we have any? No? Okay. I don't think we have any.
Okay. Since we do not have any public comments, let's move on to old business. And up first is the construction and demolition of for the license.
For the Springfield landfill.
Yes.
Yes. Okay. So one thing on the agenda, anything time it says Chris Cook, it's Gracie. So, hi. Yes. Landfill, Megan, if I say anything wrong or you have any additional information, let me know. But as an update to the landfill, as you know, they're working with the consultant to get everything up to speed so they can be relicensed for this year. We did get a response from the landfill on the 1st of April with their that included a full stability slope stability analysis. So they are making progress. They're trying to make the improvements. However, there is the Ohio EPA. There are some deficiencies that they need to work on, but the landfill has not received the official notice of deficiencies from the Ohio EPA yet. So they are waiting on that, but there is progress being made. So the recommendation from us and Megan is to table this once again, like we have the past couple months, let them continue to operate on the 2025 license since the progress is being made and they are being communicative with us. And we're just waiting on that Ohio EPA notice.
Okay. We have a motion before us for tabling the approval of the 2026 license for the Springfield landfill pending response by the landfill to the Ohio EPA review.
So moved.
Second.
Are there any questions? Okay, I see no questions. Shannon, can we have roll call?
Mr. Adamson,
Yes.
Ms. DeWitt,
Yes.
Dr. Moore,
Yes.
Mr. Griffith,
Yes.
Ms. McGregor.
Yes.
Okay. Vital statistics.
Yes, so this is for the vital statistics replacement fees. So as a reminder, this would be a fee that is a local fee will be assigned if for some reason there is a mistake on behalf of like funeral homes when they put in the information for death certificate, if it needs to get reprinted and they made a mistake to get it. So there would be a $10 replacement fee. So this is the third reading and adoption of that fee. It would be a start, if passed tonight, effective Monday, April 20th.
Okay. So this is for the third reading and adoption of the vital statistic record replacement fee. And are there any questions that members of the board have about that fee? Nope. Ask for a motion and second, please.
So moved.
Second.
Okay. Since we didn't have any questions, we'll move on to roll call.
Ms. DeWitt,
Yes.
Dr. Moore,
Yes.
Mr. Griffith,
Yes.
Ms. McGregor,
Yes.
Mr. Adamson.
Yes.
Motion carries. New business. Sewage variance request. Ms. Megan.
Good evening. So we do have a sewage variance request for 3659 Full Cream Road, Springfield, Ohio. So the owner is requesting a variance to build a storage barn. I believe it is a 30 by 40 storage barn, approximately 6 feet from the current leach field. So code requires 10 feet isolation distances. Be met when there's a structure near a septic system, so close to the tank or a leach field. The property, however, is accessible to Northampton sanitary sewer. So when that current septic system fails, they will be required at that point to tie into the sanitary sewer. So we reviewed this request and we would not be opposed to the board approving the variance request to be 6 feet away from their current leach field.
So we're asking for a motion and second to approve a sewage variance at 3659 Full Cream Road.
So moved.
Second.
Okay. I just want to make sure that I'm clear in understanding that right now it's going to be 6 feet away and we require 10. However, they have to hook into the public sewage system.
When that system goes bad.
Okay, so, okay,
There's no need for a replacement area.
got it. Thank you so very
Yep.
much.
Is the Pike Township agreeable to this?
As far as we know, yes, we've been in communication.
Any other questions? Okay, roll call, please.
Dr. Moore,
Yes.
Mr. Adamson,
Yes.
Ms. McGregor,
Yes.
Mr. Griffith,
Yes.
Ms. DeWitt. Yes.
Solid waste nuisance at 3349 Maplewood Avenue. Ms. Megan.
Yep, so we have been involved with a solid waste nuisance on Maplewood Street for approximately 9 months. So over the past 9 months, we have been observing, scattered litter in the yard, at times odors, garbage in and outside the containers, different accumulations of solid waste really in the yard. Now the house is a little bit more dilapidated, but I do believe someone is still living there. Even today, doing a quick drive-by follow-up, there were dogs in the windows and things like that. Have not been able to make contact with the owner. We've sent multiple notices. Pictures today are pretty accurate to the ones that I provided in the board packet. You can still see the plywood and things around the house. So we would recommend that the board declares the property a public health nuisance to prevent any additional risks of odors or attraction of rodents, pets, pests, etc., and require that the property be cleaned up.
And you said these pictures are recent?
Yeah, so the recent ones in your packet are from,
29.
March.
yeah, and we have some from March, and then back out today, I do have additional pictures over here that are printed out, but very, very similar to that.
Megan, what happens when we do that?
So we are asking you to declare it a public health nuisance and allow them 21 days to clean it up on their own. And then we will go back out, and if it has not been cleaned up, at this point, we have been sending them to the prosecutor for further guidance and steps of whether they want to fine, clean up.
Okay.
We're asking for a motion and second declaring a public health nuisance at 3349 Maple Street.
Maplewood Avenue.
Oh, Maplewood. Maplewood. What did I just call it? Maple Street? Oh, can somebody correct that?
We got you.
So moved.
Second.
Are there any questions? Okay, for a nuisance, could you call the roll, please?
Yes. Dr. Moore,
Yes.
Mr. Adamson,
Yes.
Ms. McGregor,
Yes.
Ms. DeWitt,
Yes.
Mr. Griffith.
Yes.
FCFC shared funding agreement.
Yes, thank you. So FCFC is Family and Children's First Council. So this is an agreement that we enter into every year. In the Ohio Revised Code, the health department in the county is a mandated board member of the Family and Children's First Council. And it is a shared pooled funding agreement for every mandated member. So our portion of the funding is $8,000. It has been for the last 7 or 8 years. So that's good, stays level. But so this is just approval to enter into that funding agreement.
We have before the board a resolution approving the Family and Children First Council shared funding agreement of not to exceed $8,000.
So moved.
Second.
Are there any questions? Ms. Hackett,
Dr. Moore,
yes.
Mr. Adamson,
Yes.
Ms. McGregor,
Yes.
Mr. Griffith,
Yes.
Ms. DeWitt.
Yes.
Employee health insurance renewal negotiations.
Yes. So everybody's favorite topic, health insurance, right? So for newer board members, our plan year is not a calendar year. It goes from July to June 30th. Just when we happen to move off the county's insurance, that's just when it happened. So our open enrollment is happening very soon. So if you remember last year, we came to the board and asked for a resolution to allow Chris or the health commissioner to negotiate directly with Anthem on a rate. We did that specifically with Anthem because they were willing to negotiate if we didn't shop around. Unfortunately, this year, the rate came in significantly higher than we had budgeted. So we normally budget for about a 12% increase. So we are looking to shop, and we are in the process of being shopped out and getting quotes. Unfortunately, Aetna has already declined to quote us, but we have hope that other people will. So what this resolution is giving the health commissioner the authority to negotiate with all the companies to get the best rate possible, with the stipulation that as soon as we have that locked in, the board will be notified of both the health department's portion and the employee's portion. So just to give you an idea, last year, the initial quote for our traditional PPO increase was 30.42%, and we negotiated it to 15.84%. And the high deductible HSA increase last year started at 26%, almost 27%, and we negotiated it down to a 12% increase. So we're hopeful that we don't know where it'll land, but we're hopeful that we can get it at least similar to last year, but hopeful in the climate of health insurance. But so that is what this resolution is just giving the health commissioner the authority to negotiate the best rate.
And that rate came in at how much percent increase?
30. Yeah.
Basically 30.
So starting kind of where we started last year, which gives us hope, there's reasons to be optimistic.
All right, so we have before you a resolution authorizing the health commissioner to negotiate and do all things necessary to enter into agreement for employee health insurance for July 1, 2026 through June 30, 2027. And we're instructing the health commissioner to advise the board of the total cost to the agency and employees.
So moved. Second.
Are there any additional questions about the insurance?
Grace, here, do we use a broker for that? or
We
do you
do,
like direct?
yeah,
Okay.
yeah, we do a broker, Walls and Turner.
Okay.
Yep.
All right.
Any other questions? Ms. Hackathorn? Roll call.
Ms. DeWitt,
Yes.
Mr. Adamson,
Yes.
Ms. McGregor,
Yes.
Mr. Griffith,
Yes.
Dr. Moore.
Yes. Okay. Personnel policy update.
Yes, thank you. So this is just minor updates. So if you remember at our last meeting, we looked at the pay scale for the intermittent employees that we bring on. So we needed to, because we changed that, the way we're going to bring them on. So for new or board members that weren't here last month is intermittent. There were some rates that were fixed for intermittent employees for some positions. Some positions didn't have an intermittent rate. So in order to keep things as consistent as possible, we figured it didn't make sense that we weren't bringing them in the same way we do everybody else, meaning where do they fall on a pay scale with their experience, and that is the pay rate. So we changed that in the pay scale, so then the personnel policy needs to mirror some of that language. So there are three main changes in the personnel policy. You have a copy in your packet, so anything in red is what's changing. So the first thing is an intermittent employee does not serve a probationary period. That's because there's no layoff procedures for intermittent employees. If we just won't call them in to be used. The second is that all newly appointed intermittent employees will come on at the level of a 2, whatever it's a health planner 2, public health nurse 2, home visitor 2. And then within that 2 range, their experience will dictate whether they start at the bottom or if they've had 30 years, things like that. And then the third increase is that the intermittent employees are eligible for the cost of living adjustment, which they have not been eligible for in the past. So those are the three minor updates to the personnel policy that reflect what we did last month.
Okay, we have before you a resolution to approve the update to the personnel policy as it affects intermittent employees. Any motion and a second?
So moved.
Second.
Are there any questions? Ms. Hackathorn, roll call, please.
Ms. DeWitt,
Yes.
Mr. Adamson,
Yes.
Dr. Moore,
Yes.
Mr. Griffith,
Yes.
Ms. McGregor.
Yes.
Okay. Grant submissions.
It's me again. So there's 4 grant submissions. So I'll talk about 3 of them. Cheyenne will talk about 1, and then you'll vote them all as a package. So the first one on the agenda that I'll talk about is Creating Healthy Communities. So this is a grant through the Ohio Department of Health. It's a continuation grant. It's budgeted. So this is the second year of a 5-year cycle. It's for $95,000. The program supports healthy eating, active living initiatives. So like the bike share program, health supports community gardens, food banks, things like the food bank. So things like that. So we've had it for many years, and Ashley Maxavides is the coordinator for that one. The next one is Safe Communities. So this is through the Ohio Traffic Safety Office. This is another one that we've had for many years. It's a continuation, but budgeted. It's $55,000, and the state tells us how much we are eligible to apply for this grant based on some metrics. So this is really traffic safety awareness, the click it or ticket, drive sober, get pulled over, don't text and drive, phones down, things like that. Those are all encompassed in this grant. And the last one that I will talk about is the Adolescent Health and Resiliency Grant. So this is a grant through the Ohio Department of Health. We currently have it right now. So we're ending It's on a federal fiscal year, so at the end of September, the current iteration of this grant 3-year cycle will be over. So this will be competitive this year. It's for $100,000, and it focuses on preparing and training adults that work with kids in trauma-informed care, and to be that trusted adult youth can go to. So it talks about adverse childhood experiences, childhood trauma, and resiliency. So we are looking for permission to apply for that new iteration of the Adolescent Health Grant. So then turn over to Cheyenne.
Yeah, so the grant for nursing is our sexual health and wellness grant. It's the one that supports our main clinic. Through the clinic, we're able to offer STI testing, contraceptions, outreaches, just education services. This one, ODH also tells us like how much we can submit for. And so for this year, it was 269,000, thankfully not 2,000. But unfortunately, we did get cut. It was a little over 30,000 was what we took a cut on. But there was a second one I was looking like we were not getting it. So we're pretty excited about that milestone.
We'd be happy to answer any questions on any of them.
Okay, we have a resolution before the board authorizing the health commissioner to do all things necessary, including submitting grant applications and negotiating and executing the contracts for the 4 mentioned grants. Remember those. I will.
No. Okay.
All right. Can I get a motion and a second, please?
So moved.
Second.
All right, any discussion? Questions? Ms. Hackathorn?
Mr. Adamson,
Yes.
Ms. McGregor,
Yes.
Mr. Griffith,
Yes.
Ms. DeWitt,
Yes.
Dr. Moore.
Yes. Okay, staffing changes.
Position upgrades.
Got one.
Oh, gosh, I skipped that.
Some people might not want you to skip that one.
Okay, positions update, that's great.
Yes. So I'll start and then give it to Cheyenne again. So Zareen is currently a health planner 1. She's been with us a year. Zareen works in our 1-to-1 harm reduction program and recently took over the full coordination of our overdose prevention program with the promotion of Jacob to the health planning supervisor. She is a great addition to the health planning team. She is a hard worker, she learns fast, and she has really made 1-to-1 and the drug overdose program her own and has really adapted well over the past year. And I'm glad she has chosen to work for the health department. And I just ask that you consider moving her from a health planner 1 to a health planner 2.
And then I'm here to talk about Nick Aldridge, who's actually with us today. Nick in the corner there. His journey at CCCHD has been a little different. When he first came in, he was actually the refugee clinic coordinator. So he's been with us since November of 2024, so a little over a year. But then with the funding cuts, that clinic got shut. So he transitioned over to be a disease investigator, which he's done very, very well at. So he's coming up on his year. He contributes to the team immensely, and so he does a great job, and we'd love to see him get up as a disease investigator too.
Sorry, didn't mean to skip you. All right, so I have a resolution before the board to approve the personnel policy updates. Position upgrades.
So moved. Second.
Are there any questions? Ms. Hackathorn?
Mr. Griffith,
Yes.
Mr. Adamson,
Yes.
Ms. McGregor,
Yes.
Ms. DeWitt,
Yes,
Dr. Moore.
Yes,
thank you, Nick.
thank you.
Congratulations.
And make sure you tell,
Zareen,
yeah,
I will.
thank you also.
Absolutely.
Staffing changes.
Thank you. We just had one promotion, which is environmental health. So I think Megan will share more of that in her report. Not on here. It will be on next month, but I wanted to note, because Megan may share that as well, that we did have a new hire. It'll show up next month, but she may talk about it because it will be happening in a week and a half. So that's all I have. No resignations or retirements, so that's good.
All right, so I have a resolution for the board appointing new employees to public health service as recommended by the health commissioner, hired between March 20th and April 16th.
So moved.
Second.
Any questions? Okay. Ms. Hackathorn?
Mr. Adamson,
Yes.
Dr. Moore,
Yes.
Ms. DeWitt,
Yes.
Mr. Griffith,
Yes.
Ms. McGregor.
Yes.
Moving to financial reports.
Starting off with the expenses and the vouchers. I try and get it down to fewer pages, but it is a lot of pages. I'm really sorry. It's part of it's because it breaks it out by each individual fund, and then it tallies them all up on the last page. $158,000 this month. Now these are non-payroll expenses. Probably the most important number is the one that's not on there. This number is that 158 is usually over 200,000 because of the presence of health insurance payments. We paid health insurance on February 28th and again on April 2nd. So for the month of March, it's not showing up there. So if you're like, boy, that seems lower than last month, it is. But it's still, it's a lot of little expenses. I asked our new fiscal clerk, Mariah Testerment, I said, hey, if you're a board member and you're looking at this list, which ones do you want to hear about? She went through it. She's got some inside knowledge, but she felt like most of the biggies were fairly self-explanatory, but I am happy to talk about anything on here. If you have any questions about any of these expenditures.
So I do have a question about this thing. Oh, never mind. I thought it said Arby's.
It's on the first page, right?
Right.
Yeah.
And I was like,
I wish.
did we really spend that much there?
We got our workforce development meal at Little Caesars.
Okay. And let's see here. Expenses and vouchers. Need a motion for expenses and vouchers to be paid.
So moved. Second.
Are there any questions about? I already answered that one. Ms. Hackathorn?
Mr. Adamson,
Yes.
Ms. DeWitt,
Yes.
Mr. Griffith,
Yes.
Dr. Moore,
Yes.
Ms. McGregor.
Okay. Any transfers and advances?
Nothing that wasn't budgeted for.
Okay. All right, so that we could do there and monthly report.
Because the first page is a standard one. It's our revenues and expenditures on our 8201, our general fund account. Okay. Big month in this account. We got one of our 2 tax settlements. So if you look at the activity for the month, you can see that very first line up in the top right corner, we brought in almost 1.5 million. Those are real estate taxes, right? We get those twice a year. So that's that fund. The next 2 are the ones that I kind of want to talk about. They look very similar, other than the fact one's black and white and one has a lot of colors. The first one, the one that's black and white, these are fund by fund for the month. So you have a beginning cash balance for the month, you have money coming in, money going out, and then an ending cash balance at the end of the month, okay, for each of those 40-some funds. The other one, the new sheet of many colors, right, breaks them into our 7 groups. So they're no longer in numerical order except within those color-coded groupings. Last month I told you, hey, the totals and the graphs that generate off of them on the next page, they still included the transfers and the advances. This month they do not. I've taken the transfers and advances out, which makes for example, the general fund, the blue expenses seem about $600,000 less. And it makes some of our revenues all totaled about $600,000 less as well. For apples to apples comparison, the numbers from last year, I took the first 3 months worth of transfers and advances out of those as well. So those graphs are the same data from the same point in time. Revenues increased slightly, expenses decreased quite a bit. I consider both of those good news. To show you what I backed out of the funds, that third piece there, it's only about that much data, but those are the transfers and advances that I took out of all of our funds for this month's report, and will continue to do so going forward. The totals don't change because it's just taking money from your right pocket and putting it in your left pocket, but it's a more accurate picture of what we're actually bringing in, what we're spending.
I like it.
I like the comparison between the 2 years. That really is significant.
I appreciate that, and I've told this group before, any data you want to see on a regular basis, let me know. I'm happy to include it. I'm giving you what I think is important, but if there's something that you're not seeing that you feel is important, please mention it.
Very nice, thank you.
Thank you, Jim.
So, I think we're moving on to
Team report.
Public health record.
Team report.
reports.
Yeah.
Starting with Megan.
Yes. Good evening again. Just a few more things to touch base with, in terms of EH. So as Shannon alluded to, we did promote Emily Grieser to an EH supervisor. She's going to oversee programs including food, pools, campgrounds, manufactured home parks, solid waste, and then the related nuisances within those programs. Emily has been with us for 6 years as an EHSIT and REHS. She started about the week before the pandemic hit, and she was a trooper through all of it, let me tell you. So it's exciting for her that she took that promotion with us. And then just this week, actually like 2 days ago, we offered one of the EHSIT positions to a candidate who accepted it, and he will start on the 27th, if not sooner. But he is actually a recent Wittenberg grad. So he lives in Clark County, he's from Clark County, and he's eager to work in the community in which he lives and wants to give back. So that's exciting. We are, however, continuing to accept resumes for the other position that we have open. So we'll work through that. And then not as busy as the last board meeting update, but last week we did complete our Ohio EPA solid waste program survey. All in all, that went well. I'm happy to say that Jennifer Michelson will be filling in as Anne retires and leaves. Jennifer Michelson was able to shadow with her and the Ohio EPA that survey, which was great. Good feedback from the surveyor from the Ohio EPA, so that'll be a good transition there. And then just a couple more things. All of our campground and swimming pool renewals are out, so they've been coming back in, so we're getting those back in. And then we have set a date for our Ohio Department of Agriculture food survey that'll take place on June 1st. So, still talking about surveys. So, but any other questions?
Who did you say you had hired from Wittenberg? Did I not catch the name?
His name is Douglas McClure. So he is local and he is ready to come on board.
Wonderful.
Thank you.
Yep.
Any questions? Ms. Taylor.
Right, so in the packet, you'll see that the community disease report for the first quarter is in there. And there's a couple things to note on that. There's been changes in reporting for like flu and COVID. So those numbers, when you're looking towards last year and this year, they're a little skewed. It's hard to get a good count of that. But on the flu one, you will see that it's a lot lower this year, but that's actually normal. Last year, we had a very odd flu season. It didn't peak until February. So our numbers this time last year were a lot higher than they were this year, but this that's a typical kind of number for a flu. And then also our tuberculosis, it says 0 new cases. We did actually have 2 new cases, but it's going to go on last year's because when they go back, it's not based on the diagnosis. There's symptomology and all of that for when they consider them being like a new case. So those 2 numbers will actually be a part of 2025, but they were diagnosed in this first quarter. And then I also have Miss Madison Wirtz here. She was going to introduce herself. She is our newest communicable disease nurse, and she's been here for roughly 6 months, getting ready to come up at orientation. So she wanted to come and introduce herself to the board.
Again, my name is Madison Works. I am a registered nurse. I've been a nurse for about 5 years. Previous experience, ICU, advanced care, cardiac, and recently labor and delivery. I started here about 6 months ago. Love it. I work with Nick and Cheyenne a lot, so part of the communicable disease team. Glad to be here to help serve and protect our community. So.
Thank you. Welcome.
And I just want to give a kudos to both of them for being here today. Like our CD team this last year, it's been through a lot of changes, and myself included. I was brand new in CD, so me and Nick, there was a time last summer that was just me and him winging it. We were just actually living life, and so he stuck with it. So I appreciate both of them for sure.
Thank you.
Next week is March National Home Visiting Week, and that's celebrated across the country. So here in Ohio, approximately 10,000 people, or I should say not people, families participate in Help Me Grow Home Visiting through the state grants. We know that positive early experiences, especially those built through strong supportive relationships, are critical to healthy child development. Our evidence-based program, Healthy Families America, plays a key role in that impact. Through our work, we improve maternal health, promote positive parenting, increase the adoption of safe sleep practices, support higher breastfeeding rates, help children meet developmental milestones, and connect families to vital resources. And I put in your packet this time, let's see, in 2025, here it is, we did 3,899 home visits, and it showed how many families that we served this last year. And this is some of the pictures in there, some of the families that we've been serving this year. So hopefully you find that report kind of helpful to kind of get a snapshot of who all we're serving. And each of those visits represents a meaningful support that the family is receiving by a dedicated home visitor committed to helping them succeed. So we're incredibly grateful to our talented home visiting team here at the health department because they make such a great difference every day, those families. Yeah, so that's next week is National Home Visiting Week.
Wonderful. I'm seeing that we have 10 families on the wait list. That's kind of picked up quite a bit, hasn't it?
Actually, it's gone down, actually. Last year, I had 67, like at the beginning of the year, a whole lot.
Mm-hmm.
And it's slowly been going down, but part of that has to do with the fact that we have other providers in our community, like the Nurse Family Partnership. So they're serving families, and that was one of the reasons why we needed some additional providers. And then there's another Healthy Families America provider that just has one home visitor. So that's why our wait list has gone down so much. So that's probably a good thing.
All right.
Yeah.
Thank you so very much.
Thank you. Last month, we saw a slight rebound in our total participant numbers when compared to February, which was an increase of 54. Typically, in the second quarter, we see a decrease in total caseload over the months of January, February, and March. And then when comparing the hospital visits to last year, our dietitian Ashley saw an increase of those numbers for February by 20 and March by 13, which was nice to see. And then this month, we saw an update to the WIC food package. And the law requires the USDA to conduct a review of the WIC food packages at least every 10 years. The last update was in 2014, so it was overdue. And then the packages get updated to reflect nutrition science, public health concerns, and cultural eating patterns. These changes are meant to provide an underconsumed nutrients, improve the nutrition and health of WIC participants while tailoring to special dietary needs, personal and cultural food preferences. So just some highlights to note of the changes. Canned fish has been added as an option for across the board for 1 and older. A reduction in the juice, but with the option to replace this with an additional cash value benefit towards fruits and vegetables, trying to lower that sugar intake. The option to replace eggs with additional legumes for those with food allergies or other preferences. They did remove chocolate milk, which was very disappointing to a lot of families. But we did have the option to increase the yogurt substitution amounts. The ability to offer additional formula supplementation in the birth month for partially breastfeeding moms. That was always a challenge, sticking to that one can if they needed additional support there. And then the option for infants to receive a cash value benefit towards fruits and vegetables to replace all or some of their baby foods. So for those families who want to make their own baby foods or they're doing baby-led weaning. We are only in our first week of the new changes. There were some hiccups with the start date, but overall it seems to be positive. And then the last thing I had last month, there was some curiosity on what a Dip It Bowl was. So that was one of the items we provided during National Nutrition Month. So I thought I'd bring a little show and tell. So there's a larger section and you can put fruits, veggies, cereal, and then there's a smaller section so that can house like your dips, so yogurt or hummus during snack time. So just thought I'd bring that in for show and tell.
Thank you so much.
But that's all I have this month. Or if there's any questions, I'm happy to answer them.
Thank you. So the markets will be opening back up. Can they use their WIC at the market?
The farmer's market?
Yeah.
So there's separate coupons right now. They're looking to go to the EBT option, but that has not come to fruition yet.
Thank you. Health planning.
Yes, thank you. So you have the packet, the health planning packet that talks about all of the health planning programs. So if you have any questions, I'm happy to answer those. Just to highlight a few, since the weather is starting to get nicer again, we are doing, picking back up on in the overdose prevention program, our GROW blitzes, which is GROW stands for Get Recovery Options Working. So this is our door-to-door taking overdose and recovery information to neighborhoods that are more highly effective with overdose. And we do that through heat mapping. And we also provide naloxone and things like that. So that is starting up actually tomorrow for the year because of the weather. And then the other thing I wanted to highlight, and City Commissioner Ricketts will talk a little bit about this, is through our tobacco grant. One of our big initiatives is advocating for enhancements to the tobacco retailer license that is currently adopted by the city of Springfield. So we have something in place right now, but increased fines and some other like proximities to youth serving organizations and schools is some of the enhancements that we are advocating for. So Larry, I don't know if you want to say anything more about that.
I would. Thank you. Thanks for giving me a few minutes tonight. I'll just give you a quick update. While you were having your meeting last month, at the same time we were having our yearly commission meeting and staff meeting on goals and objectives for this next year. And one of our top priorities is the enhancements on this tobacco 21 the ordinance that we have. We are aware that, you know, there's 130 tobacco shops in Clark County. There are 97 in the city. 48% of those are within a 10-minute walk from the schools. So we realize, you know, how important this is. And in the past, you know, the fines were low enough that some of these tobacco shops, if they got caught selling to minors, they just looked at it as a cost of doing business. And we want to change that. A couple of the enhancements that we're looking at, and our law director is working on this now to make sure that we're within the state law and that we don't, you know, try to supersede that. But one of the things we want to do is look at proximity to these schools by these retailers. unfortunately, the shops that are already there are grandfathered in, so there's nothing we can do about that. But eventually, we want to make it so that when a shop closes down and a new one opens up, they have to be further away from schools. That's one of our goals. The other is to increase the penalties. Honestly, we want it to hurt. We don't want it to be a cost of doing business. You know, when the health department does a presentation to us and we talk about the health of Clark County, this is a big piece of it. And we want to do what we can in the city to assist in making for a healthier environment. So eventually, there'll be a first offense and the fine will be at least twice as what it is right now. The second offense will be even higher. Eventually, on the third and fourth offense, you could actually lose your license. And if you lose your license, then that place will be gone and the next one that opens up will have to be further away. One of the other things we'd like to look at, and we're checking on the legality of it, is the displays that these places have. I mean, they just say, come on in, come on in. And it's tough for kids to not be drawn in by that. So that's another thing that we're going to be looking at this year. It's kind of stunning that we have more tobacco retailers here in Clark County than places like Youngstown and Mansfield and places like that. And it's just kind of the nature of, unfortunately, Clark County. But we are very attuned to this, and especially Commissioner Wallace and myself are taking the lead on this. And we are going to eventually, when the law director has the wording correct, we will probably be coming to you and asking for a resolution to back this. We don't want this to look like, oh, big government's trying to tell us what to do again. And again, this is all for trying to get the schools, we're really trying to protect the kids. That's what we're trying to do. And so eventually, I don't know how long it's going to take, but sometime later on this year, we'll come to you and ask for a resolution to support this. So, anybody have any questions?
I have one. When you have a tobacco license, does that include vaping and all
Yes.
of the pieces? Okay, so you have to have a tobacco license to sell those products as well?
Yes, you
And
do.
also, what about, in some of these shops, they're selling THC
Yep.
enriched Delta 9, Delta 8.
Yeah, there's all kinds of reasons to
Yeah.
increase this.
So this is all
Yes.
this is all encompassing.
Tobacco use, I think your own statistics show that tobacco use is down. Vaping is way up.
Yeah.
For the kids. When you
With
said
kids.
kids, I thought,
Yeah.
God, I hope this.
And, I was really stunned. I wish I had a picture to show you. Your, Leah,
Yes,
the
health cleaner.
program, sent me a photo of one of the new vaping things. Now, some of these vaping things, they're like a toy. They actually, they have microchips in them, and you can go back and forth and play games with people, and it depends on, you try to see how many hits you can take. But the most bizarre one I've ever seen is and I posted it on Facebook, and Facebook made me take this down. Because this vapor looked like a gun. And to use it, you turn around and you stick it in your mouth and you pull the trigger. And Facebook made me take it down because it looked like a real gun. That's what this looked like. I mean, after 3 or 4 days, they came back and they said, oh, okay, well, we guess this is not a violent type of thing. And I basically just posted it so that people could say, look, this is what they're making now. This is the game that's out there. So.
You had made mention that if the shop closes that's near a school, then that shop would be permanently closed if they close down. But what if I sold my shop that's near a school?
Yeah, and there's the catch.
Yeah.
Yes, if you sold it to somebody, it's sort of like selling a liquor license or anything else. Somebody else can just adopt that. And in fact, the question was brought up, well, okay, we've caught you on your fourth violation. and you're gonna lose your license. Well, what if that person then turns around and sells it to their brother or a cousin or whatever? And that's probably gonna be allowed. So it's gonna be tough, but at least we wanna put the mechanisms in place that, we can start doing that.
Is there a public, or is there a mechanism to, like, if someone's in violation of publishing that for the public?
I don't know that. That's a good question, and I don't know that. I'm sure that we'll find that out when we're passing our resolution and the newspaper is there and somebody, I hope, will, we might even bring up that question. But yeah, you're right. If somebody gets, let's just say that the newspaper coverage isn't what it used to be.
I will say, since the license are issued through the health department, just a couple things. It's not transferable. So if one was to sell, the new owners, if it's through a new name, would have to buy a new license. And since we do the compliance checks, we talked about the whole publishing of names when we've done them in the past. But since the health department does the compliance checks, anything would be public record. So people could request those. And just about the synthetic THC and Delta 8. So this tobacco retail license doesn't cover that. That would fall under the state law that just went into effect. Yeah.
Let me just say, playing the devil's advocate, is that kind of like a conflict of interest when we're issuing the license to something we want to crack down?
So
You
the,
have to be able to monitor it some way, I guess.
yeah, so we're issuing the license saying you, in the city of Springfield, retailers that sell nicotine, tobacco, any type of tobacco paraphernalia, I think is what it states in the ordinance, is to be able to sell that. You're buying the license and ensuring that you are only selling to people that are 21 years old or older. And so I'm not an advocate for smoking or vaping for anyone, but if you're following the law, that's your prerogative to buy it. So what we do the compliance check. So what we do is send in underage buyers. So someone that's over 18 or over, but under 21, just to see if they're following the T21 law that's in Ohio. So.
Yeah, I don't think because adults can do whatever they want.
Yeah.
This is basically the same as a liquor license.
Right.
As far as like, you don't want them selling alcohol to minors either.
I think liquor licenses are a little more rigorous.
Yeah.
Much more.
Yes. Yeah.
Well, and again, we're trying to make this stronger because, years ago, you didn't have really, it was against the law, but you didn't have a city ordinance. I don't know if the county has an ordinance.
It can't be, it has to be a municipality.
It has
So,
to be municipality.
yeah.
Okay, so we can't, ask the county to join.
yeah. Yeah. So,
Tracy, are there a finite number, like the liquor licenses, is there a finite?
no. And that's something we talked about initially, like having a density and like a number, but that's not currently.
Where we are?
Yeah.
Yeah, that's the proximity and retailer density clauses that we want to try to put in there. And again, the law director has to be able to tell us
What you can.
what we can and can't do.
Yeah.
Ideally, what we do is find somebody else that's already done it, and then we don't reinvent the wheel. We say,
Right.
"Oh, it's done in Toledo, we can do it here."
Youngstown.
Yeah, and we have looked into like comparable sister cities and those legacy cities, and we definitely have one of the higher densities of tobacco retailers within the city limits. Yeah, so I just appreciate Commissioner Ricketts and Commissioner Wallace for being such great advocates for this. Leah, who is our tobacco prevention program coordinator, does a great job. And it's just really great to have the support. So thank you.
Yeah, she does do a great job. I became really interested in this when she came to the city commission meeting last year and brought in. It's great.
They've seen the Tubbo vapes.
I wasn't commissioning them, but I was looking at it and I thought, why did she bring in all this Halloween candy? Because that's what it looked like from the audience, was just, Okay, thank you very much.
Thank you, Lou.
Thank you very much. Okay. All right, legislative updates.
and deputy health commissioner comments. How about that? Okay, so I have two brief legislative updates for you. I think Chris has talked about House Bill 692, which is the update to the household sewage rules. Does that sound familiar to anyone? So what this bill proposes is some pretty significant changes to the household sewer rules that kind of go in the opposite direction of what public health would support, meaning it's taking a lot of some of the requirements down, like not requiring soil analysis, the operation and maintenance programs where every system being inspected on a 12-month basis would become optional, because right now the law is that every county needs to implement this program. That would become optional. Some other limitations, and then another big one is repairs to systems. If they would allow replacement of systems without any substantive changes without a permit. So again, all of these things add up to things that could be pretty detrimental to public's health. So some slightly optimistic news, though. The Association of Ohio Health Commissioners actually have met with the bill's sponsors, and the bill sponsors were receptive of hearing why these changes would be negatively impact public health. And they are interested in the ask from AOHC, like what could we do to help improve and not keep it as is. So AOHC is putting together their recommendations, and we are hopeful that an amended bill is going to be put forward, taking away some of these so significant changes. Where it lands, we don't know, but that is a positive step, we think. So just wanted to give you an update about that. Any questions? Megan, do you have anything else about that?
So I just want to be clear.
Mm-hmm.
Okay. So in this new legislation, I can go out, if my septic failed, I could just go out there and repair it myself.
Yes.
Pretty much.
Okay. And,
Yeah.
and I don't have to call y'all.
Mm-mm. See where the problem
Have
could come in.
Have someone install it or replace it with no permitting and no inspections.
We
Mhm.
would have no record of it, we wouldn't know what's on the property,
Okay.
or the property stuff, yeah, contaminating groundwater.
So does this apply to like new builds too? So if I just wanted to put a trench,
Well, if the soil scientist aspect is taken out of it,
Yeah.
it will significantly alter the way we install any septic system, new or replacement.
so I wouldn't even like have to have a septic system, I could just have a trench out there. I just want to be clear right now.
Potentially, yeah, I mean, the way they were proposing taking away I don't believe the proposal will take away like the amount of leaching and everything that's required as in bedroom count, but
Mm-mm.
taking the soil scientists out of it.
Yeah, that's a huge
that's a huge
part of it.
part of it.
So,
And I thought that,
Interesting.
that made it that it wouldn't come to your attention until it was.
there was a
already
problem. Yes, correct.
And so you had made a statement tonight about if it was passed,
Mhm.
that it would become optional at the local level. Is that
For
also still-
for the specific operations and management program. Right now, it's in the law that every county eventually adopt that program. So that means every septic system is inspected and on a rotation for inspections, so that we can catch things before they become an issue. With the bill as written right now, that becomes optional, and counties don't have to, local health departments don't have to do that.
What was the purpose of this bill being written this way? Does anybody know like what the benefit they thought they were
Yes.
creating?
I think the thought of it was, so there are a limited number of soil scientists
Mhm.
in the state. And so when you have to replace your septic system, it's not a quick overnight fix.
Right.
So I think part of it is the time factor.
Mhm. Yeah.
But that's not the solution.
Yeah.
So I'm also thinking here, if I don't have to really like have a septic system, but we also have this, if I put, the city brings in sewage, does that mean now I don't really have an obligation to hook up to that? So you know how we're bringing in,
Yeah, and they have to, if their current septic system
Right.
fails, they have to tie in.
right,
I think that's two separate things.
Yeah, I'm not sure.
But yeah, I think that was the stand.
okay. But how do I know that there's failed up there?
Well, that's.
Somebody
Okay.
complains.
Yeah,
Yes.
and through a complaint, yeah. Yeah.
Okay.
So optimistic that it's not gonna get passed as is. But still waiting to see on that, but wanted to give you an update. The other bill, it's a House Bill 676. It's in House Committee right now, but it focuses on wolf dog hybrids. So it's a type, it's a type of dog. So what this bill does is it would treat wolf dog hybrids in the same category as aggressive dogs. Okay. Where the kind of issue comes in is there's no approved rabies vaccine for wolf dog hybrids. So they don't have a rabies vaccine. So if these animals are involved in a bite situation, they will automatically be unvaccinated because even if it's off label or something, it would not be considered vaccinated. So when that happens, it's automatic euthanasia for the animal. Yeah. So what the state is looking through the state vet and AOHC is looking to see exploring if there's any other possible, whether it's monitor with action and things like that for these wolf dog hybrids. So the first step isn't to unfortunately have to put the dog down. It could really put health commissioners in a tough spot when no matter what, if they're involved in a bite, the health commissioner has to say, well, your dog has to be put down. So not a fun situation for anybody. Don't know if there is going to be a way around that. But like I said, it's still in House Committee, but that's where we're at with wolf dog hybrids. Learn something new every day, huh? Okay, so that is all the legislative updates. Just a couple other things. We did just want to thank all of you, thank the board for closing our offices for our Workforce Development Day on April 7th. Thank you, Emily. On April 7th. So as you know, twice a year, we do a Workforce Development Day with all of our staff to go learn about community partners, do some team building, things like that. It's always a great day. We have it at the Clark State LRC building. And we had a lot of fun this year, in April. I think we did some music bingo and categories, if anybody remembers that. But we had a lot of really good presentations from community partners. We learned a lot. So we just wanted to thank you all for that as well. And then we also, that same week of Workforce Development Day, is we celebrated Public Health Week. And the Thursday of that week, the leadership team put together made to order salads for all of the staff. So it's a little something that we can do to thank the staff for all their hard work and dedication to public health and Clark County. It's fun to put the salads together. We listened to some music as we did it. And then we also provided everyone with a public health t-shirt that you have as well. So we're excited about that. And then the only other thing I will say is the Minority Health Fair is next Saturday, April 25th from 10 to 1 at Hayward Middle School. We have over 50 vendors coming. And we have dental screenings, vision screenings. Mercy Health is kind enough to do the labs again. So it's always a great day. So if you're out and about next Saturday, stop by Hayward from 10 to 1. We will be there. So I think that's all I have.
Good stuff. Let's see here. We do have executive session.
Mhm.
Okay, so we want to adjourn.
Oh, no, you gotta have a motion.
Motion.
So if you want to, because, yeah, just read that entire. Yeah.
Okay. Next regular meeting, okay. Can I have a motion and a second to enter into executive session?
Ooh, can you read the whole thing to state the purpose?
Okay.
Sorry.
Executive session for the purpose of conferring for pending or imminent court action.
So moved.
Second.
Any questions? Ms. Hackathorn roll.
Mr. Griffith,
Yes.
Mr. Adamson,
Yes.
Dr. Moore,
Yes,
Ms. McGregor,
Yes.
Ms. DeWitt.
Yes.
okay.
Yeah, and then just announce the last bullet.
Announce that no action will be taken by the board following the results of the executive session. Okay?
Yep, you're
All right.
Okay. Thank you.